I think the one thing that people generally don't know about the industry is really how timely it is and how important it is, because drugs are not just sitting on shelves all the time, especially high cost specialty medications. They're not just going to be on a shelf. They're going to be a just in time inventory model. And so sometimes you have to, you know, take that risk in bad weather to be able to ship that product, even if you're risking losing that product, to make sure that that patient gets it. Because if it's an oncology product, I mean, these patients, they can't have any lapses in their therapy. And you understand that our role in the supply chain ultimately affects the patient at the end of the day, even if we don't see them.
If I'm talking to a policymaker, it's very much about, we're not in it just for the money. We are in it for the patient. And so when we think about our margin, it's very, very small. When I think about somebody outside of the regulatory space, the important thing to understand is that there are so many people involved in getting that product from the starting point to the patient that you really can't just focus on one area. You really have to understand how broad that supply chain is and how many people are involved.
You know, there's a lot that goes on in this industry. There's a lot of hurdles. There's a lot of, you know, regulatory changes and law changes that impact many people throughout the industry, you know, going from the manufacturers, the wholesalers, to the customers who purchase that medication. And then even, you know, with my company, where we handle those reverse distribution and taking those medications out of the supply chain entirely. So I would say, you know, be friendly, try to think of the holistic, the general supply chain, and not just pinpoint one area, because there are ripple effects. And I've noticed that greatly through my first 1 to 2 years being in the supply chain, that one small decision with a small niche group within the supply chain can actually have large ripples, you know, downstream.
When I think about, you know, what makes our pharmaceutical industry different or stand out from other distribution businesses out there, I have to say it's the resiliency of this industry. We're all here to service patients, you know, and save lives.